Thank you, everybody, for coming. On behalf of my fellow interns and myself, I'd like to welcome you to Santa Rounds 2011. Maybe unfortunately or fortunately, Santa had a extremely complicated hospital course, so as a result of that, we had to take a very large volume of material sitting in this paper chart up front and condense it into a what we're attempting to make into a succinct presentation. So bear with us as we go through a hospital course, and try not to judge our medical reliability, I guess, as we go through some of this. And without further ado, I think most of you have seen this picture. This is who was initially admitted as patient trauma, Chris. He was noted to be a 450-year-old rotund white male, found unresponsive in the Boston Common in a puddle of eggnog. It was mentioned that EMS was called by a 4-foot 10-inch green man wearing pointy shoes. Just before patient Chris hit the ground, he had said he'd traveled here from the North Pole, so acutely delirious. Upon arrival, he, oh, excuse me, here's the story I just told you. His ED course was somewhat complicated and included a code environment run by an intern, which we're going to show you a short clip of.
450-year-old man, he was knocked down in the common by EMS. We've got airway, he's already been intubated. Can we get breath sounds here? Do we have bilateral breath sounds? Bilateral?
We do. I can hear breath sounds bilaterally.
All right, outstanding. Here we've got a pressure. It's 117/59. Let's get another. It's up from our baseline of 80, so that's pretty good. How are we doing on pulses? Do we have pulses?
Alright, I roll pulse here.
Okay.
Roll pulses bilateral.
Alright, let's make sure we've got some lines. We're getting ranges. We've got an EEG here.
I'll work on the Foley. I'll get the Foley.
Alright. Let's shake his spine. Alright, just kind of continue to hold. Is he conscious here? I don't see anything. Just lean on. Okay.
Alright,
Okay.
we got a 1-minute clip.
Dr. Anderson? Yes, as you can see, what was potentially a hectic trauma stat was handled expertly by the intern trauma team. In the ED, Santa was noted to have a temperature of 103.6. He was tachycardic, hypotensive, and required supplemental oxygen. He was intubated in the field for a low GCS. And on exam, it was important to know he had scleral icterus. He was tachycardic with reindeer gallops and jingle bells. He had slabored breathing. His abdomen was jolly-like and rotund, and he did grimace to right upper quadrant palpation. His rectal exam was significant for bright red and green urine. His labs were shown above. He had elevations of his bilirubin, his liver enzymes, and he had an elevated white count. And we'll go through his images now. As you can see, this is who is known to us now as Trauma Chris. His chest X-ray is kind of classic for eggnog aspiration syndrome. You can see the bilateral north polar infiltrating. And then on the CT scan, you'll have to look very closely, but you can see what appears to be a lump of coal in his tongue, bile duct, and his gallbladder. And they were burning so hot that actually lit up red on the CT scan, something that hasn't been described before. Also some there in his pancreas.
Dr. Barrow?
So, with the above findings, Trauma Chris was found to have what we know as the reindeer pentad. He had fever, jaundice, right upper quadrant pain, hypotension, and mental status changes. And so with all these findings and these wonderful images presented by Dr. Anderson, he was diagnosed with cholangitis, and he was most likely found down due to his sepsis from his cholangitis, and probably a mixture of that and some exotic intoxication. So our plan was to admit him to the SICU and consult everyone and do everything. So he was admitted to the SICU where he had wonderful one-on-one nursing care with Q1-hour vital signs, and Lee Schmidt was on hand to immediately place a central line.
you explain what you're doing?
I'm trying to put us a plane like this. 550 pounds and comes here unprepared as always. He still doesn't learn. I do not understand this. Why does he hate us at MGH so much?
Dr. Bonin.
So, Mr. Claus was noted to be in severe septic shock and had multi-organ dysfunction. At first, we all believed that his prognosis was quite grim. As his hospital course progressed, we realized that his prognosis was even worse than we initially thought. He had a history of surviving similar admissions and problems, but we understood that we needed to involve multiple different services. And then we had to consult Mrs. Claus, or at least try and contact Mrs. Claus to have a discussion regarding the goals of care. Things were looking bleak. This is what Dr. Alam contributed on hospital day 1.
One of the first teams consulted was, this patient was well known to Dr. Ratner, so it made sense to admit him to Team 5 since he would most likely need an interval cholecystectomy at some point. And so Dr. Tim Millington, the chief of the Baker 5 service, had a couple of things to say, which we'll read to you. Twas the week before Christmas when on Blake 12 I encountered the shell of a once jolly elf. His skin had turned yellow from the chin to his legs, and his vent came with the smell of digested nutmeg. His arms were strapped to the stretcher with care in hopes that a psych consult soon would be there. His jaundice and fever suggest an infection, and bile tube clogged with some tasty infection. I'm not sure he'll make it to 1225. Let's hope that Mass General can keep him alive. Tim suggested that we consult pet therapy. We immediately marched an entire herd of reindeers into the room, on that notion. Thank you, Dr. Millington.
So the SICU did a wonderful job rounding on him several times a day and leaving excellent notes. One of their initial recommendations was to order a PET scan. Unfortunately, the order is taken literally, and Rudolph was called in to scan Mr. Claus. We immediately sorted this out with radiology. I don't really know why they had such a misunderstanding of this. And then we started him on chemoperfusion over polymix and feed column to remove traces of egotoxin from his blood. And we suspected he might, in the future, require some egg vote. We also started on the anti-eggnog withdrawal protocol using gumdrops and cookie elixir and ringing bells Q15 minutes. The SICU was in quite disarray from all this. We tried to contact Mrs. Claus, but we were unable to. We were concerned that she was possibly with contact. The Boston police were contacted and the North Pole police, and we spotted some elves and Rudolph sort of running around in the Boston around the group.
This now brings us to hospital day 2, where we wanted to feature some of the more creative things that the surgical ICU nursing care did for him. This was a big sign on the door in the room, and some of the material in here is quite funny if you have a chance to read it. We have the sign that will be in the Russell Museum with the rest of his paper record. As Jordan alluded to earlier, we had Q1 hour vitals through his entire admission, which we greatly appreciated, and the level of detail was quite robust.
Of note, during these Q1 hour vitals, Santa was noted to have a temperature of 108 at one point, and they gave him a very nice icicle bath and immediately brought his temperature down to 99.
I believe Louis Schmidt is now studying this for the protocol for the Arctic chill that he uses in the SICU. This new icicle cooling.
A very concerning EKG was obtained by the nurses. Dr. Merrill? Dr. Godin?
So Dr. Godin was consulted because he was admitted he had a blood sugar in the 800s, most likely due to his chronic eggnog consumption. So we saw him in the morning of his hospital day 1, noted that he had a blood sugar of 450 and hemoglobin A1C greater than 20. So then he was sorry to see this old friend back in the hospital again, inconveniently, and so close to this time of his peak yearly responsibilities. He's previously known to have a room-wide gastric bypass, Team 5 surgery. And so
Dr. Shelito was consulted due to this interesting finding of bright red-green correctum, which we have an image of, and noted that his last colonoscopy, he had numerous polyps surrounded in a wreath-like distribution. In his assessment plan, he figured this was due to a hypervascular polyposis syndrome in combination with torsion and ischemic necrosis causing this green discharge. And it has actually been described, who knew, as Christmas tree polyposis. Here's an image of bright red and green correctum with actually a parasitic infection for which infectious diseases was consulted. At this point in time, he needed to be percutaneously drained back to the cholangitis, and Dr. Mueller, who was away, I believe, playing golf at this time, finally came in, and instead of us reading to you what he said, he asked if we would mind showing him actually reading it. I'm here at Santa's room, Mr. Claus's room, with Dr. Peter Mueller from radiology, who's going to interpret this abdominal CAT scan for us.
Okay, thanks, Jordan. It was a cold winter's day in the IR suite when a call came down about a special patient we all wanted to meet. Santa was in the ICU and on the brink. Oh, what a troubling Christmas for all in MGH Inc. Santa was sick in the ICU in a special bay. He needed some drainage and to eat. Indeed, on Christmas Eve, he had to fly his sleigh. Santa looked a little pale and short of breath. The surgeons ordered a CT, but interpretation was out of their depth. They called out to help poor Santa out. The team ran quickly, because who wants to see Santa pout? Quickly they did a perc gastrostomy with flare. They added a chest tube to let the lungs air. Still, his abdomen was distended and he looked quite bloated. On his CT, many collections were noted. Children were worried. Would he make Christmas Eve? So more IR catheters did he receive. Santa was fed and now feeling well. He looked up and claimed, boy, the IR team was swell. He leaped up and he called to his reindeer. And then, with a smile on his face, he said, see you next year.
Thank you, Dr. Mueller.
Unfortunately, Dr. Mueller failed to mention that when Santa was in the IR suite, he coded on the we had to run a stat code. This is Dr. Merrill providing some important resuscitation.
Now, I have to say that there's been a dirty rumor as to the identity of this individual, so it's important. As proof of that, since you were the endoscopist here, would you want to comment on the ERCP?
So we decided to take him to ERCP. And we decided to bring him to do an ERCP at the same time. We needed a whole team of interns to do. I put the right scope in the right place. We were able to take the call.
On hospital day 2, we noticed that the patient had a change in his toe, known as the mistletoe, and consulted vascular surgery, where Dr. Riesel gave a witty consult here, encouraging the hair of the dog approach and putting the feet in warm eggnog. She also wanted to obtain PVRs, Prancer, Vixen, and Rudolph's Q1 hour, which nursing was very upset about, and to apply Silva bells to the necrotic digits, which we did. We also thought that lighting a candle, or as Jordan Bonin suggests, possibly aid, couldn't hurt.
OMFS was also consulted, and Santa underwent a nasopharyngoscopy. A null maneuver showed that there was 100% airway collapse, a significant amount of exit in the naso and oropharynx. His mandibular fracture did not require closed reduction with any candy cane arch barbed wire fixation. He was then done.
So this brings us to sort of an uncomfortable moment where Dr. Najad was consulted, and what we've shown you here is just a very brief sample of his consult, because unfortunately is rated R and probably not appropriate to be viewed here. However, he did, after he left the patient acutely went into a catatonic state, and so Dr. Najad asked us to consult one of his colleagues who came to do ECT, Dr. Welsh. Image of that.
In the report, Santa was acutely despondent about a leak of snow in the northern hemisphere this year, and the new 80-hour workweek restrictions for reindeer and
At this point in time, I don't know if it had anything to do with the site consult or what, but there were complaints from the nurses and from some of the staff up in the ICU that there was policy being violated, that there was need for a safety report. So the nurses actually took it upon themselves to page Dr. Lillimo, who came to the bedside to review some of this.
It's very serious. I see numerous skip violations, numerous violations of isolation precaution. HIPAA rules have not been followed. Patient-family communication has been abysmal. My understanding is significant work hours violations and taking care of patients. And the costs are probably going to filter down to the department, which is already financially strapped.
I think I'm just going to have to talk to Cam Wright.
Dr. Wright, I think we have a meeting after this.
Following this, we started to realize that Santa had been offered his eggnog for quite a while, so nutrition was consulted for the chief complaint of inadequate eggnog intake. Their recommendations included beginning some semi-elemental feeds with peppermint swirl, containing the four main food groups: candy, candy cane, candy corn, and last but not least, syrup. Reference the movie Elf. We also had to ensure adequate hydration with melted snow.
At this point in time, when Dr. Molina was examining the patient, he noted that the patient had profound ELF adenopathy and decided that probably a consult with Dr. Tanabe would be relevant. Dr. Anderson's going to tell us about that.
Well, yes, on the exam he was noted to have significant cervical ELF adenopathy, and it was felt that this could represent some sort of reindeer variant lymphoma. So we consulted Dr. Tanabe to do a biopsy of those nodes.
Before I show you the biopsy, I do also want to give credit to Dr. Damrauer, who actually did a literature review and found in the Annals of Fuller Surgery, where I believe Dr. Lillimo may be the editor, that this variant has been shown to be associated with colon, and we know that he's got colon inside of him, so thank you for pointing that out. Here's a clip of the physical exam by Dr. Tanabe.
Dr. Tanabe, you were consulted earlier today. What seems to be the problem?
I think that this gentleman has ELF adenopathy, bilateral cervical, and yeah, actually everywhere it feels mobile and spongy. Yeah, I'll have to check his scans to check out this ELF adenopathy.
Well, if you could come up with a diagnosis, what do you think this man might have?
Well, yeah, Dr. Damrauer and I were discussing this in the operating room, and antler cell lymphoma was certainly on the differential, but I think we'll need to investigate this further.
Did you say lymphohoma there?
Lymphoma ho-ho? No.
Pause for a moment of silence.
So, Santa... Dr. Tanabe, Santa subsequently underwent a supraclavicular lymph node biopsy, and a frozen section revealed Reed-Sternberg cells of the Rudolph antler variant. The right panel here depicts a special staining with FITC labeled ELF anti-antler IgG and Texas red labeled ELF anti-Rudolph IgG monoclonal antibodies merged with the H&E image. Pathology was quite helpful here. Before we get to their report, I would just like to show you a magnified version of the Reed-Sternberg cells here. So the report was sent down to pathology with the final pathologic diagnosis, which is up in CAS of Rudolph antler cell variant lymphoma. Just to read a little bit here, the tissue cores are effaced by an infiltrate of large jolly lymphoid cells with many admixed small typical mistletoe-berry cells. The large cells have crisp-crinkled nuclei and prominent red-nosed Rudolph-type nucleoli. They have abundant amphiphilic bowl full of jelly cytoplasm with occasional antler-like projections.
We thank the entire team of pathologists for reviewing these images.
They rushed a stat for us, they were able to do it in 1 hour.
Another quite concerning finding was the presence of Grinch bodies that the hematology lab pointed out. Here,
So, additionally, once it was realized that Santa was suffering from such a terrible affliction, we were asked to make some additional surgical oncology recs regarding a SIPEC, a supercooled intraperitoneal chemotherapy with peppermint schnapps. Subsequently, hemog, and due to the Grinch bodies as well on the smear.
so the next day, hemog saw the patient, and Dr. Merrill's going to tell us what they found.
So they found these Grinch bodies on the smear that are named after the Senor John Grinch, a half-Spanish, half-Austrian hematologist who abandoned medicine to dedicate his life to banishment of Christmas. They recommended that we treat him with Sandostatin, a monoclonal antibody directed against CD242, followed by fully myeloablative allogenic stem cell transplant.
At this point, we feel it's worthy to take a small commercial break. This one is sponsored by our very own chief residents.
Say an apology to Eugene Hiroko and Tim Millington, whose photos are nowhere to be found. I don't know if there's something to that, but everything else came up.
Sure. So back to serious matters. On the most recent EKG on this day, Santa was noted to have ventricular bigiminy with north axis deviation. And believed to have a shrinking, shriveling heart. Dr. Abraham was consulted, of course, and he asked us to send Santa for a cardiac cath, possible PCI for likely eggnog quadrant coronaries. And of note, he also recommended a stacked ECMO consult, which Drs. Ryan and Duty immediately responded to.
Drs. Ryan and Duty, what are you here for?
This poor ageless male is in severe cardiorespiratory failure. The only thing left to try is ECMO. So,
is that the machine there?
This is the machine. We don't have enough green for it, so we gotta just do what we have. We'll put them on to red. And see if we can't support it for at least a few days. But we gotta take it off on the 24th.
I believe he might be going to the OR tomorrow. Will he be able to travel on ECMO?
We can. We don't want to, but we can. So if it's important, we can get them done or do procedures on ECMO.
But what is this guy's
real risk, though.
and what is Santa's prognosis as of now?
Without ECMO, I think he's a goner.
Even with ECMO.
But I'm pretty sure he'll be better by the 24th.
I think so too.
A special thanks to Drs. Ryan and Duty for providing this life-saving measure. And also for documenting a very official JCO procedure.
So next we consulted the Churchill White team. Mr. Claus was well known over his past 60 years of admissions to the Churchill teams. He had undergone multiple trace and pegs. He also had serial back changes for his sleigh for his ulcers. Unfortunately, Mr. Claus was not quite compliant, and Dr. Gleason came to deliver the following letter. Dear Mr. Claus, 'twas the week before Christmas, and all through the wing, the last Churchill clinic was going off with a bang. The patients lined up, and their wounds they did bear, but alas, 9 a.m., and St. Nick was not there. Please understand, we are very busy. Dispensary alone would make anyone dizzy. From your failure to show, I must say with regret, we can no longer see you, per the words of Annette. We don't want to leave you out there in the cold. There are other surgeons worth their weight in gold. Treiser, our intern, fixes wounds that are Jewish. He's even working this weekend, as I'm told he's Jewish. De Moya alum, I've heard King is back, and nobody beats bacon pulse with the back. GB will fix you up your hernia with SurgiMed. I think that's a study, so please send a friend. If it's specialty care that your heart does desire, we have so many, even since Warshaw's retire. As he locked up his door, he said, gotta go, but I'll introduce you to Keith Lillamo. On vascular, thoracic, plastics, and breasts, Sir John Pediatrics and Brothers with their best. To the top of the Ellison and bottom of Lunder, our surgical services will fill you with wonder. The view from the Phillips house is of ships on the bay, but you can only get there if you have MRSA. Alas, every floor has top-notch nursing. They are skilled in our caring without even rehearsing. But you did not show up for your scheduled visit. It's impossible to care for you since you did miss it. If you need further care, whether near or far, you can always check into the nearest ER.
What would an admission be without an orthopedic consult? Next, ortho was consulted, and we got some extremely helpful information from one of the orthopedic interns that he has this condition never seen before called asystole. And she noted there's a fracture, and we need to fix it. It's an LC1 horse open sleigh pelvic variety. Requires a pelvic binder made by the striker elves, which I'm not sure if they're allowed in the MGH. And the activity restrictions were to limit weight of children sitting on his lap to 40 pounds, which could potentially be a problem given the childhood obesity epidemic.
So neurosurgery was subsequently consulted for chief complaint of gelastic seizures. The imaging here reveals an ill-defined red enhancing lesion or two noted on the bilateral amygdala that appear to be several hundred years old. There's a hypothalamic mass without enhancement. This lesion has led to hyperphagia, hyperorality, and unusual docility in the face of reckless reindeer and disobedient children. This is likely hypothalamic disease, which may be the cause of the gelastic seizures. Similarly, a recent case was reported by Comet et al. In the Association of Arctic Neurosurgeons. This patient will need ICP monitoring and will place a reindeer antler bolt. Thank you, Dr. Stable.
The MNR was consulted for unknown disco needs in the future. We figured that Santa would probably be a disco nightmare. He specifically recommended a huge reindeer rehab, and we consulted PT to know what he needed.
For both inpatient and outpatient needs.
This is PT demonstrating really a textbook patient transfer, which we rely on them heavily for.
I'm Karen, this is Julia. We are physical therapists, and we are getting ready to assist Santa to the edge of the bed and hopefully be able to get him out of bed to the chair. All right, we're going to get over to the chair. All right. Dementia transfer times 2. 1, 2, 3.
We thank them for their contribution. Now, in case any of you are wondering where this is going as we start to wrap up here, he came in with a problem, and throughout all these different consultations, we've determined that he's really in need of transplantation of multiple organs. This jaundice that he has been getting, for some reason, has been irreversible, and as you'll see a picture of him shortly, he's turning into a figure that we're not comfortable with, and what better time than now to maybe consult with plastic surgeons and ask for a face transplant. But the place where we thought we would start is with his fulminant liver failure, which Dr. Anderson's going to comment on.
That's right. He was, unfortunately, after going through all this, he was found to be in fulminant liver failure. The transplant service was consulted. They noted that he had a long past medical history. They did check the list twice. He was noted on exam. He's younger than stated age. He had red green sclera and spider NGO that were encircling his neck like a polyp. Unfortunately, due to his ongoing eggnog use, he was deemed to be an unacceptable candidate for human donor. So he came to a couple of options, either a Christmas miracle or perhaps a xenotransplant. And then,
plastic surgery was consulted for evaluation of a face transplant, secondary to irreversible jaundice with bridge-like appearance. Of note, the patient was not found his wallet on admission. But we did find it. Unfortunately, the family did not want the face transplant. Please reconsult us if you do happen to find his wallet or any cash.
So this is a good time to mention that this entire hospital admission has the status of the who's going to be paying the bill has been a problem. Mr. Claus has no health insurance and he's not a Massachusetts resident. So our very own elf here, Jordan Bonin, arranged a meeting with Dr. Slavin to cover these issues, which we'll show you.
Elf, and I'm here with MGH President Dr. Peter Slavin. Thank you very much for joining us today.
It's my pleasure.
Dr. Slavin, as you know, Mr. Santa Claus was readmitted to MGH only 2 days ago, and he's now in the surgical ICU in severe condition, critical condition. What were your first thoughts when you found out that Mr. Claus was back?
I was really sorry to hear that he was back in the hospital and so sick. I understand his condition is very grave, but very pleased that we have 15 different services consulting his care. He's going to get his best shot possible here at Mass General in the ICU on Blake 12. And everybody here at the hospital, I'm sure kids around the world are keeping their fingers crossed that he makes a very speedy recovery.
Yes, they certainly are. As I think you know, Mr. Claus does not have Massachusetts eligible insurance. What is MGH's official policy regarding his cost of care?
Well, since he's been a patient of ours on a repeated basis, we're committed to providing him with any care that he needs. The current estimate is that his bill may well exceed $100 million, and we're prepared to stand by that. We're not exactly sure how we'll make up that $100 million. Certainly he gives pretty generously around the world, and if he survives this incident and is grateful for his care here, as I'm sure he will be, perhaps some of those gifts will be directed our way.
So as we all expected, Santa Claus required multiple operations. So as the attending on record, Dr. Markman took the lead, and Dr. Lahakis, Dr. May, Dr. Wayne, Dr. Tanabe also were included. This was a very long case, 20-hour case to be exact, and it was really a multiple organ transplant to save Christmas. So he had a heart transplant, face transplant. The heart transplant was done for hardening of the heart, which Dr. Abraham had noted. And the face transplant was done because it was turning into the Grinch. So that needed repair. And double lung transplant for coal miners, lung and superimposed reindeer dropping pneumonia, and the liver failure, as we mentioned. And what we found was that the liver failure was actually distal liver failure. So he was actually not believing in Christmas anymore. Did these surgeons do the operation? So, great question, great question. So, Dr. Berger saw this and said, so Dr. Berger actually canceled the case and stayed for 2 hours and a half all by himself, and everything went well. Unfortunately, though, before the case had actually proceeded, it was an email circulated that Dr. Berger was not did not have the privileges for this operation. He still continued forward and did go on to save Christmas.
He actually finished early.
These are just some images of the operating room and all the different procedures that were done. And so at this point, we want to show you sort of how he looked when he was admitted, or maybe, you know, this is potentially could represent pre-jaundice, and what he had sort of turned into, and then we wanted to unveil the results of the first face transplant at the Mass General Hospital. So toward the end of the admission, what you'll slowly start to see fading in was what he had changed into. This may or may not be a PGY3 here, I don't know if you can recognize it. And I think at this point, guys, should we show the results of the first MGH transplant? You guys do the honors? Almost there.
So you think it's fun to have a face like a Grinch? Looks like it's plastered with semi-cooked spinach. Well, the docs of the MGH, this wonderful place, have given me a spectacular, splendiferous new face. And now, with this gift that you've given to me, I can happily go off on my annual holiday spree.
So we just wanted to leave you with a couple of outtakes, a couple of things that we found humorous through this, and then we're done. We appreciate your attention. This is not an outtake. This is just a picture from on White 7. There were multiple occasions to steal Santa from the Blake 12 unit and transfer him down to White 7, which we prevented. This sounds like something that I might make up, but I'm assured from Jordan Bonin and PJ Spencer and George Molina that this is how CPR is taught at Harvard Medical School. And I think they entitled it CPR Reverse Cowboy Style. This is Andrea posing on the child seat in the IR suite. We're not exactly sure why, but we thought we'd show it. A couple of photo opportunities. Just a nice picture here of some of the people that helped out. This was us 12:15 a.m., about 2 hours before we departed last night. Off the clock, obviously. Working diligently. And lastly, we just have about a 2-minute video clip with a few additional outtakes, and then we're done.
Anything to say for yourself as you're getting ready?
Ho, ho, ho.
Good morning, Elliot.
Morning. Merry Hanukkah. Jordan, you would film yourself just looking into the camera. I don't think Santa typically wears underwear. And I don't think
Jeff, you wear underwear. Probably Jeff would actually take his pants off instead of just putting the pants over his jeans.
Well, you don't want to take or anything.
Jeff is the only non-Jewish person.
Andrea.
Oh, she missed it. She's going to be married at this point. She's definitely mad at me.
Hello?
Interview Elliot as Peter Slavin.
My name is Jordan. I'm a well-dressed elf.
Elf? Yes.
I like my master's.
Why aren't you wearing pants, Jordan? Why are you asking me? Dr. Slavin, is it possible for the surgical interns of the MGH to get a raise? Research month for the surgical interns.
Why does he come and doesn't pay? I don't understand. You know, Satona is not paying patients anymore.
Peter Slavin's covering this one, I heard.
Oh, good. Okay, so we are safe for this year. Okay, 1, 2, 3.
The patient's acutely short of breath.
Yes, who's that?
Here he comes for some.
The buyer goes pretty easy.
Hi there, my name is Jordan, the elf, and I'm here with MGH President, Dr. Peter Slavin. Thank you very much for joining us today. No, it's my pleasure. Dr. Slavin, as you know, Mr. Santa Claus was readmitted back to the hospital only 2 days ago. Apparently he was found down in Boston Common in a puddle of eggnog, admitted with severe cholangitis, and is now in...
You're on video now. You're on video now. You're on video now. You're on video now.
Well, Mr. Lett, how about I just go? I think I'll have to talk to you more. Yeah.
Thank you.
Come on, Laura.
All right, we thank you all for your attention. First-time celebrant of MGH Santa Claus Grand Rounds. This has been fantastic. I know you guys have been working very hard. Dr. Warshaw has done a great job of coaching you, and it's been a lot of fun. I even see Dr. Torchiana back up there, so he can report that the Department of Surgery is doing well. Really, happy holidays to everyone. Be safe over the holidays, and again, thanks so much to this great group of interns for putting this together. No grand rounds next week, so we'll see you all in January.
That's me, I need to stay in the eating all day.